Doing really well here, Neil. And you?
Fantastic. Today's topic is typhoid fever. Is there a difference between typhus and typhoid fever?
Actually, there is. Typhoid fever is caused by something, it's a bacteria. They're both bacteria, but uh, um, typhoid fever is caused by Salmonella typhi rather than rickettsia, which causes typhus.
What causes typhoid fever?
It's Salmonella typhi. It lives in the intestines of people who are infected. And what it does is contaminates food and water.
How is typhoid fever spread?
Well, it's through eating contaminated food or drinking contaminated water, and often due to poor sanitation. Contamination happens when somebody who has typhoid fever um, touches something without washing their hands. For example, the telephone, the keypad, the doorknob. That's how you get typhoid fever.
Can you get typhoid fever by kissing?
Nope, that's one of the things you can't get by kissing.
All right, so that's you won't be able to get it there. Can I get typhoid fever from my phone, my keypad, or my doorknobs?
Absolutely. Again, it's spread by touch. For people who have the bacterium in their gut, if they don't wash their hands after they go to the bathroom and they touch one of those things, that's how infection occurs.
What are the symptoms of typhoid fever?
Fever, chills, headache, loss of appetite, stomach pain, diarrhea, constipation, cough, muscle aches, rash, and it has a pink spot rash on the chest and abdomen.
How do you prevent typhoid fever?
Good hygiene, safe food and water, and there is a vaccination which is not recommended by the CDC.
What are the stages of typhoid fever?
Well, there are four. The first one is in the first week. It can occur, you can get symptoms 5 to 14 days after coming in contact with it. And they call this a stepwise fever because it goes up a little bit more every day. In the second week, bacteria are multiplying in your immune system, and that's when you get the abdominal pain and the rose spots. Stage three, that's when you should get your antibiotics to prevent severe damage, internal bleeding, and encephalitis. Stage four is recovery.
How do you diagnose typhoid fever?
Well, the lab, you can get blood tests and you can get stool studies.
What antibiotics are used to treat typhoid fever?
Oh, ciprofloxacin, levofloxacin, ofloxacin, ceftriaxone, cefotaxime, cefiximine, and erythromycin.
Where can I go back to work? When can I go back to work or school?
Well, it depends on, but in some places you're going to have to get a negative test for typhoid fever before you can go back to work.
Is typhoid fever still around?
Yeah, it is. In the year 2000, there were 21.7 million cases and 217,000 deaths. It attacks young people, 5 to 19 years old. And in 2013, there were 161,000 deaths. It is deadly, just not deadly in our country.
Should I have typhoid fever vaccine?
Well, like I said, the CDC doesn't even recommend it. But if you are going to travel to a place where um, it is endemic, where there's a lot of it, then you should get the vaccine. And there are two choices for the vaccine. One of them is an injection, and the other is oral.
All right, the best place to go is roll.allen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the rural doc.